Live from SSM Health Trevor Studios, my name is Dr. Ashton Sue, and welcome to Divergent Minds. If this is your first time joining us at SSM Health's Divergent Minds, let me introduce you to the show. We're a weekly mental health podcast where we talk about everything related to mental health. Myself and Dr. Chapman is unfortunately not here today, but enjoying Europe right now, to my jealousy. We are both child and adolescent psychiatrists who see young children, teenagers, and adults. And this week, we've been talking a little bit more about substance use, and we're going to be talking about cannabis use, particularly cannabis use disorder. Now, as a disclaimer, I am not supporting the cannabis industry in any which way, but my job as a physician and as a psychiatrist is to help individuals understand what are the substances they're consuming. Are they good for them? Or are they bad for them? How does that affect their mental health? Today, we're going to talk about the pharmacology of cannabis. We're going to talk about many formulations and subtypes of it. We're going to talk about signs of intoxication and withdrawal. And then how do we as doctors diagnose that this is an issue in individuals, right? And so I think it's super, super important. Today is going to be kind of a lecture. So if there are chats or questions, I'll try to answer them. But I'm going to be getting through a lot of slides today. So we'll see how fast I can kind of get through questions as well as these slides. But I do encourage them. So why cannabis, right? Cannabis, is cannabis, marijuana, these terms can be interchangeable, but actually cannabis is a plant that contains what we call phytocannabinoid. It's known as THC and CBD. So cannabis is the plant. And this is the term we should be using in a medical setting. The term marijuana has a complicated history. And while you may hear it used in many settings, it has certainly been used by US politicians since the early 20th century to negatively associate the substance with people of color, such as Latinos, Africans, Black, and Chinese communities. So when people ask me what's the typical case that comes into my office regarding cannabis use disorder, it's typically this. A 17-year-old comes into our clinic. They're with a concern for an ADHD evaluation. Grades have been declining over the year. They're forgetful about assignments, also forget about obligations or responsibilities at home. They're very distracted in conversation. They think, parents think that this girl is starting to feel depressed and that they want to get a better assessment. And so they do what we call a neuropsych testing, where it's a long 8-hour drawn out testing to figure out what is exactly going on. And there have been no histories of challenges in the past prior to this year. So as we get more and more into the interview, we start interviewing this individual. We find out, there's a 3-month romantic relationship with a girl in the class. Like they're still exploring their sexuality. My parents might be devastated to find out about the relationship. I don't even want to think about what happened if they find out. So there's an extra layer. But when you get into start talking to this individual, they say, they have these stressors. And they're not a big deal. I just don't really like thinking about it too much. And I try to kind of keep myself to avoid kind of dating. And so I wonder, I'm getting told that there's a gray box in the middle screen. Hopefully that changed it around. So, you find out slowly in the interview that she's vaping every day. She's tried dabbing, helps with anxiety. There's no other kind of substance use. And you as a doctor are like, okay, vaping, dabbing, what does this even mean? And they tell you, don't tell my parents what happened, right? So I just wanted to highlight this case because this is a typical case that comes into our office, right? Not just sexuality, gender expression, and conflicts at home. Regarding that, we're also dealing with substance use. And then we're also dealing with confidentiality. And there are many layers to that. We're not going to go into that. But what I want to highlight today is the substance use portion, because this is really important for parents and mental health, practitioners, pediatricians, and the audience who might be watching of how we as psychiatrists approach this. So I think the first thing we have to talk about is that people often say cannabis is not addictive. And that actually is a myth. 1 in 6 adolescents will meet the criteria for cannabis use disorder. What is cannabis use disorder? Well, cannabis use disorder is when individuals start using cannabis for longer periods and larger amounts of time, unable to cut down the use, excessive time spent acquiring it, using and recovering from cannabis use, a strong urge to use cannabis. They just tell you they can cut down, but they're unable to. Problems fulfilling work responsibilities or your school responsibilities. And even though they keep on getting in trouble regarding their cannabis use, they keep using. And I think the biggest thing is that as the cannabis use increases, they have to use more amount to get the same desired effect. So, as you can see, with all of these criteria and symptoms, if you have more of these symptoms, the more severe the cannabis use disorder is. And people say that cannabis does not cause physical dependence. Well, it actually does cause physical dependence. People can develop withdrawal symptoms, which I will talk about. And then people can develop what we call cannabis hyperemesis, which is cyclical vomiting, throwing up a lot after stopping to use or using. So I think it's really just important that if you're watching this in the audience, cannabis use, right? And we'll talk about the breakdowns of cannabis, but it is a substance and there are additive aspects to it or addictive aspects to it. So, this is primarily for the physicians, but this is kind of the case again. And I think it's really important that if you want to understand how common cannabis use is, what you have to understand is that this was data taken from SAMHSA, which is the Substance Abuse Mental Health Alliance. This is a federally funded program organization that takes in data from thousands and thousands of teenagers and adults regarding substance use. And what we find is that about 21% of high schoolers report monthly use of cannabis use, and 7% of high school seniors are daily or near daily users of cannabis. We know that there has been a change in the national trend of cannabis use in response to legalization, but state by state data can be hard to find. So this is federal use. And I think that's what is important to find is that even in marginalized populations, like in the LGBTQ community, cannabis use is also the number one substance to use amongst teenagers. And this is just kind of the idea, right? Look at this chart. What is this chart supposed to tell you? Well, it shows that, this is from Monitoring the Future study. This is a study that doctors look at. It basically looks at overall use and this study was done through the NIH or the National Institute of Health. And it looked at basically substance use that has kind of substances that have been used over the past decade. And there's been about a 13.2% increase in marijuana use or cannabis use compared to other or in general. In comparison, you have hallucinogen use also on the rise at 4.7%. So if you want to take away anything from what we've learned so far, just understand that cannabis use is on the rise and cannabis has physical dependence, and it's really important to understand how common it is amongst teenagers. Now, what are the risks of cannabis and co-alcohol co-ingestion? If you're drinking alcohol, if you're smoking weed at the same time, it can lead to significant amounts of cognitive issues. It can lead to vomiting. It can lead to what's it called? Risky behavior, driving under the influence, physical dependence. This graph basically just shows that layman's terms is getting twisted, and when individuals do that, they are at a higher risk of having really risky behaviors occurring. So co-using substances is also an important thing to kind of think about. Now, people ask, is there issues with what's the development? What happens to the brain when you smoke cannabis? And there is, in terms of a motivation, like not getting off the couch, as well as the gateway drug hypothesis, those actually don't have significant scientific founding. There's no clear foundation for emotivational syndrome or the idea that you have no motivation, though we do know that cannabis can increase the risk of depression. It's unclear if the apathy that people when they smoke is due to just cannabis or polysubstance use. Some evidence does suggest high schoolers using marijuana see less perceived benefit from school and have worse planning skills, but are still motivated in other ways. So it might be more so what are they motivated to do rather than complete loss of motivation. And I think another thing is that are people with mental illness more likely to use marijuana, or does marijuana use cause mental illness down the road? That is also really difficult for us to distinguish. At this time, marijuana use in adolescence is a risk factor for multiple health conditions, including depression, suicidal ideation, anxiety, and schizophrenia. Those are risk factors, but it doesn't immediately cause mental health issues. Multiple prospective studies do show an increased rate of schizophrenia in adolescent marijuana users. And the reason why I kind of highlight schizophrenia a lot here is not saying that marijuana will cause schizophrenia, which is a mental health condition, which we can talk about in another Divergent Minds. I think what it really highlights, there's actually a lot of data that supports that if you have a family history of schizophrenia or psychosis, then if you are smoking marijuana, meaning if there are family members who have schizophrenia, you are more likely to develop psychotic symptoms at an early age if you smoke marijuana heavily. So I always tell that to family members who are smoking often or individuals who are smoking often who have that strong family history of psychosis. Now, if you're joining us right now, my name is Dr. Ashwin Sood. This is Divergent Minds, where we talk about mental health and the intersectionality of other things that happen with mental health. And today we're talking about cannabis use. Summarize pretty quickly, cannabis use is on the rise. It's legalized in many states and decriminalized in many states. There are physical dependencies and also potential withdrawal from cannabis use or heavy cannabis use. It is really important to understand that if you use cannabis and you have a family history of psychosis or schizophrenia, that can increase your risk of developing a psychotic illness at a very young age. One thing I also want to point out is that if there's heavy use of cannabis use over multiple months to years, we know that there will be prolonged cognitive issues for a couple months until sobriety is maintained for 3 or more months. So the brain kind of has to heal over time. And if you guys have any questions, please feel free to comment. There's a lot of information to digest here. So we kind of talked about, the gateway hypothesis that there's no causal relationship to harder drugs, but we do know that individuals who use hard drugs have used marijuana in the past. But it doesn't mean that if you're going to use marijuana, you're going to use cocaine or heroin or things like that. So I think what's really important is people talk to me all the time, like, oh, weed, marijuana, cannabis, what is this? What are these things? Well, let's go to the basics, right? Let's go to some basic biology. Um, Cannabis is a plant, right? And there are different species of the plant cannabis. There's sativa, indica, and then there are mixed versions of the species. And in cannabis sativa, right, this plant, there are 565 chemical compounds, and of those, about 125 are cannabinoids. What's a cannabinoid? Well, a cannabinoid is a chemical that binds to a receptor in our brain that's called the cannabinoid 1 receptor, the cannabinoid 2 receptor. We have endocannabinoids, meaning we have internal cannabinoids that we secrete that bind to these receptors. You don't have to smoke weed or smoke marijuana or cannabis to get those endocannabinoids flowing. However, when you use cannabis sativa, you do have access to all of a sudden external or outside cannabinoid chemicals. The two most common ones that we hear all the time are THC and CBD. So these are two different chemical cannabinoids that individuals smoke, consume, inhale in different ways. And they bind to receptors in the brain. And we know that THC was isolated in 1965 and then discovered to activate certain receptors. And these receptors then lead to a whole cascading of symptoms, which I won't get into here. But I just want you guys to remember THC and CBD are phytocannabinoids, and they bind to receptors in the brain. Now, THC, when individuals consume THC or inhale or get THC into their bloodstream, they don't actually get just THC. They get the breakdown metabolite, which is called delta 9 THC, and that's the active form of THC. CBD, on the other hand, is pretty much the only chemical that kind of comes in. And so when you hear an individual who has THC and CBD in their system, they have different effects on the body. And I'll go into what those effects are. I think this is an interesting point that people often come to me and they're like, having your drug test, how long is this going to stay in my system? Well, if you smoke marijuana and it has THC in it, because that's what we look through the toxicology screening is positive for THC, right? That phytocannabinoids, not CBD. One use, typically it's about 3 days in your system. Heavy use, which is about, or moderate use, which is about 4 times a week, is about 5 days in your system. Heavy use, which is daily, it's about 10 days in your system. And then chronic daily multi-use lasts for about 30 days in your system. So this is like if you stop smoking, then and you're a heavy, daily user that you're using multiple times a day, it will be in your system for 30 days, even if you maintain sobriety for like 15 or 20 or 25 days, it will still be in there for the full 30 days. Good thing to kind of keep in mind. If you're a parent and you're dealing with this as a child and they're like, I'll just stop smoking, well, you have to explain that if they're applying for jobs, if they get your drug tested, these are kind of things you keep in mind. Uh, and so federally, I always get questions, is marijuana legal? That's such a loaded question, right? Because when we talk about legality and we talk about controlled substances, we have to understand that controlled substances federally are mandated by the DEA, the FDA, and these are things that take a long time to change. And Schedule 1 through 5 about controlled substances are basically us trying to figure out, what's the abuse potential? Is there any medical use? Is there any safety? People get dependent on these medications? And what are some examples? So if are interested, like marijuana, the plant itself is still a Schedule 1 drug, meaning it is a controlled substance that you should not have access to. But Dr. Sue, there's all different types of marijuana and access to the marijuana, like things like that. Well, that's what we call synthetic cannabinoids, where you can, and I'll talk about that a little bit more, where people alter the chemical structure a little bit. So it's not exactly CBD or THC or the plant itself. So technically, these things get sold. They're also very dangerous. And I'll get into that too as well. But those are synthetic versions of marijuana. Marijuana, the plant itself, is still federally one thing to kind of think about is still considered um, um, uh, criminalized, right? It's not necessarily legal, but state by states are changing that. There are multiple states where medical marijuana is legal for 38 states in DC as well, including DC, where that's legalized. And there's also decriminalization, where if you have a certain amount, you won't be, and you're not selling or distributing, you won't be arrested. So this is kind of the kind of general ideas that state by state, which is different. Look at your state if wherever you're listening to this from. How is it legalized? What's the state's laws behind it? Is it synthetic marijuana? You have to kind of also think about too. Schedule 3, if you look at that for a second, those include medical cannabis drugs. So this is when individuals say, I take this for like pain, or I take this to get increase my appetite or end of life care. So these are synthetic drugs that are created with the same kind of combinations of cannabis that can be utilized to treat these conditions. And they have FDA approval to treat these conditions. To get them, you have to get it prescribed by a physician. And so this is very different than like a dealer selling you pot or something like that. This is FDA approval for these particular conditions that you need a prescription for. So we are assuming that with legislation by Congress, that marijuana will be probably changed to a Schedule 3 drug sooner than later. The DEA has put in, or the FDA has indicated to the DEA that there might be changing this. It's in process. So this may be coming sooner than later that we'll see marijuana being made at a Schedule 3, which is a whole different story, right? Like that tells us that, less likely to become a felony if you're holding it, less likely to be arrested for it, easier access to it, because individuals are realizing that, a lot of people are being um, put in jail for holding such a common substance. So when we're talking about cannabis, right, like what exactly does this mean? If you're listening to this right now, we're kind of going through the breakdown of cannabis use and things of that nature. And I think what people have to realize, and this was good for learning, is that the cannabis plant cycle, the biggest portion that we need to know about with cannabis is the plant flower, right? There's three different species: the sativa, indica, hybrid. The sativa is going to be our higher THC content. The indica is going to be the high CBD level content. Both of these things are going to be causing different types of symptoms in an individual. When people smoke THC versus CBD, those with THC can often experience, energizing behavior. It can be stimulating, can sometimes reduce anxiety. It can increase creativity, increase focus. So some individuals will come to me and say, I smoke and this is how I focus and this is how I concentrate. Indica, which is high CBD, can be very relaxing, calming. It can have the pain properties. It can help decrease nausea. It can lead to quote unquote sleep. However, any substance that you take, you can develop a dependence to it. So I think it's really important to understand that any outside substances you can definitely kind of be dependent on very quickly. Uh, these are, as you can see, these two pictures, these are buds, leaves. All the way to the right, these are stems. Each of these have different concentrations of THC and CBD. And so, what do people look like when they, have natural plant derived cannabinoid intoxication? So, cannabis from the plant, right? What do they appear? Well, they might appear relaxed, hungry, they can feel euphoric. They have the red eyes, right? Sometimes they can get panicked, sometimes they can get anxious. On the overdose, if they have too much, if they smoke too much from the cannabis plant, they can feel very sedated, confused. Their heart rate will go up, their blood pressure can drop. And we most commonly see in the overdoses of individuals at a very young age where they accidentally get into something, or the teenagers where they're experimenting and treating it like alcohol. There's no immediate withdrawal from cannabis use, but if you're chronically using, right, these can be individuals will often tell me they tried to stop smoking weed and they developed, difficulty sleeping. They've had appetite suppression. They felt really anxious, really irritable. They started getting sweating, chills, headaches. So this is withdrawal symptoms from chronic heavy use. Individuals can also start vomiting a lot because these are medications that the body's kind of gotten used to for nausea. And so that also can last for some time. Many neurologic changes appear not to be fully reversible with abstinence after heavy regular use. So some of the neurologic changes, right, the anxiety, the irritability can be prolonged or indefinite if there's heavy, heavy, constant use. So, you have the 17-year-old, right, that we're talking about initially. They're smoking or vaping weed, but what does that mean, right? So I think the first thing we have to ask is THC content. That varies widely. There are many, many routes of administration. Like for the pure plant, it depends on which part of the plant, right? So the flower, which has the most THC, followed by leaves, followed by stems. And then you get to what we call hash, which is compressed resin and some of the flowers and some of the leaves. So it's a concentrated amount of THC. And then you get into kind of hash oil, you get into vaping liquid. And basically, if we look at vaping is what we call a live resin. It's basically freezing process that distills all the THC into a concentrated component. And then it's kind of like almost like a what's it called? A very high concentrated amount of THC. And so I think what's really important is that if individuals are telling you how much they're vaping, they're going to give you about a concentration of THC to CBD, which is a really good way to get how much. When people say the comment, my parents' weed is not our weed, that's very much true because there is such a significant higher amount of concentration of THC in these components of hash and vaping liquid, and dabbing is probably the most highest concentration of THC. And you notice I'm talking a lot about THCs because that leads to what we call the psychomimetic effects. When individuals use THC, they often have, alteration in perception. Time gets slower, or the perception of time gets slower. Sensory changes can occur, right? The other aspect of it is that paranoia can kind of set in. And so this is what we kind of think about in terms of the concentration. And as it gets higher and higher, you have family history of psychosis or schizophrenia. That can be really dangerous as well. I think, there's all different ways of smoking, vaporizing. These are all different ways in which individuals kind of inhale THC. So just important to know that. And then, we were talking about this patient earlier. She says, she's using 800 milligrams of marijuana a week. What does that exactly mean, right? It's not like a shot of alcohol or a couple of drinks of wine. What exactly is 800 milligrams? Well, if someone buys an 800 milligram THC cartridge, that may it is one, you're not sure how much actual THC is in it. None of this is federally regulated. So somebody who says 800 milligrams might actually be 900 or a gram, or 600 or 700, right? So the labeling is inconsistent. What's considered heavy use of THC is basically 40 milligrams in one sitting, up to 24 hours. And so if we take 800 divided by 7 days, that's about 115 milligrams per day. So this would be considered really, really heavy use. If somebody tells you, yeah, I smoke marijuana, you can ask them, how many puffs do you take from your vape? And they'll say, 4 or 5 puffs each hit. That can be anywhere between 3 and 5 milligrams of THC. I say this to an audience who's probably not in the medical field, but it's just important to remember heavy use is determined by like greater than 40 milligrams or more in one sitting. So if somebody has a vape pen and it has like a gram or 1,000 milligrams, right? And they go through that in a week, just divide it out by days to see how much they're using. And then, the major dangerous ones. So before I get into the major dangerous ones, there are pharmaceutical, which are pharmaceutical drugs that are federally regulated, that are Schedule III drugs that are given for a specific reason. And these are synthetic THC based medications that help with certain issues. So, for example, the only pharmaceutical used CBD, the only pharmaceutical that was used for pain that contains CBD also contains an equal amount of THC. Research into the effect of CBD alone on pain or mood is not well studied. Epilepsy is well studied. Epidiolex, which is 99% pure CBD, is used for a certain type of seizure disorder. And so many private markets will tell you this is a synthetic cannabinoid. It has benefits, but they're not federally regulated. These drugs that you see, Marinol, Bilanone, Bixol, Epidiolex, these are federally regulated synthetic agents that need to be prescribed for certain reasons. CBD can improve sleep disorders, pain, muscle spasticity. But again, you have to understand where you're getting the source from because none of this has been streamlined, unfortunately. The dangerous ones, the synthetic cannabinoids that affect the receptors that I tell you in the brain, these are chemically altered. And so they're not federally regulated, they're chemically altered. So technically, you can get access to these things from, the gas station or something like that. And they will, common names are include like K2, spice, kush, fake marijuana. They have hundreds of chemicals. Most of these remain legal because they're not the marijuana plant because they've been altered. And they can lead to really, really significant toxicity in a lot of nature. And how quickly, this has been seen on the New York Times, a lot of overdoses connected with fentanyl, with K2 or spice. And then the major one that has come out now is Delta 8, which you might see, microgrown. It's not a bad thing. It's a synthetic. There is Delta H in cannabis, but it's very low forms. So they're created high amounts of Delta H, THC, which can be really dangerous. So I'm not going to jump too much into most of this. What I want to kind of highlight is that, that cannabis use, right? Just think about phytocannabinoids as THC and CBD. THC is going to lead to more of the kind of psychomimetic effects, the euphoria, the time alteration, the kind of pleasure in some way, shape, or forms. CBD can lead to some of the decrease in pain, some of the assistance with calming and relaxing, and that higher amounts of THC can be more dangerous. Uh, Marijuana in itself is still not federally legal, but it is moving in the way of becoming a more less heavily what's it called, criminalized behavior, and more of a kind of more accepted and put into kind of a lower schedule class, so less likely to be arrested and given a felony for it or something. Um, from a psychiatric and doctor perspective, I always have these conversations with individuals. I never come at them as, no, 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 you're wrong, you're bad. Just kind of understand, like, how is a substance being used to help this person? How is it hurting this person? And trying to drive internal motivation for change so that they're not heavily reliant on the substance. Very complex topic. I tried to shudder all of that into 30 minutes. If you have any questions, feel free to leave a comment on this video. Next week, Dr. Will be taking a break from Divergent Minds. As I said, will be Thanksgiving break, but I'll see you in 2 weeks. Thank you guys so much for showing up, listening, and leave a comment. Hope you have a wonderful day.